Fantastic. So I understand that we have a number of people here today from districts in Budapest, and I know that you're going to be starting to put healthy streets into practice soon because the city government's setting up a funding scheme for healthy streets projects. So this will be particularly relevant to you, but I hope you'll all find it interesting. So we should start off with what is healthy streets. You'll have heard this term, and a lot of people don't know what it is and what it actually involves. So healthy streets is quite simply, and this might be familiar to you, these 10 healthy streets indicators. You may have seen this before, but the thing is, it looks really simple until you try and work out how to do it, and then you realize how complex it is. Now, how is this focus on these 10 aspects of the experience of being on streets different to all the things people have been trying to do for so many years to support walking and cycling? I want to start with this example here. This is a street near where I live. It was built brand new after the announcement that London was going to host the Olympics in 2012. So the plan was this street would really support people to walk and cycle. And if you look at this, you could say this is a good street. It's got a cycle path, it's got cycle hire, it's got some nice sustainable drainage planting, it's got a footpath on it. But this is not a healthy street. This is not what we're trying to achieve, because ultimately it's still always easier to drive and park on this street than it is to walk or to cycle. It's not just about putting in some space for walking or putting in some space for plants. It's about genuinely prioritizing people in how streets are designed and managed. And each of us in our different cities around Europe have inherited a cars first environment. And our task is, how do we make it into a people first environment? And when you leave this session today, you will see lots of little examples of the cars first environment that you are living in. And here's one from near where I live. So this is a street near my home. This is where people want to walk. This is the route they want to go, the direct line along the street. And this is where they are actually sent, all the way around here and then back. So yes, technically you can walk along this street, but a small aspect of the design has been put in place to make it easier for the people who are driving on this street than for the people who are walking. This is an environment in which people are accommodated. What we're trying to achieve is an environment where people are prioritized, and that's what we're trying to achieve with the Healthy Streets approach. Here's another example, another street near where I live. You can see the street before and after Healthy Streets was applied. First of all, we have a street where technically you can walk along it as long as you can really squeeze. And we've put that barrier up so that people can drive really fast along the street and not worry that someone's going to step out onto the road. Afterwards, we've actually widened the space for people walking and made less space for cars. So people driving have to drive slower. So pedestrians walking in single file and cars can easily go fast. That is not what we're trying to achieve. Pedestrians feeling comfortable and environments where cars have to be driven much more carefully is what Healthy Streets is about. And it's not to say that streets can't have cars in. Streets can be much healthier while still enabling car travel. And here's one example of an outer suburb in London where this happens. So these are the 10 Healthy Streets indicators. And one mistake many people make is thinking this is a list of 10 things you find on streets. This is not the case. These are 10 aspects of what it feels like to be on streets. And underpinning these 10 aspects of how it feels to be on streets are an evidence base of things that we know human beings need. So in the four corners, we can see the 4 big health impacts of urban transport: air pollution, severance, road danger, and noise pollution. At the top and the bottom, we have our top priorities: an environment in which everyone's needs are met through an accessible environment in which they can be active every day. And we need to think about all of those important factors that apply to every street everywhere in the world, which matter for an environment feeling pleasant. We've got to think of ourselves as sensory animals, and what do we need to feel? So we need to feel relaxed. We need an interesting environment with things to see and do. We need places where we can stop and rest, and we need shade and shelter. So these are the 10 Healthy Streets indicators, and they all need to work together. You can't just pick one off and say we're going to focus on this. The challenge of Healthy Streets is how do you get all 10 working together? And they all interrelate. So if you try and make a change to one of the indicators, you're going to have a knock-on impact on other indicators. If you make a street easier to cross, then it's going to feel safer. If people feel safer, they're more likely to choose to walk and cycle. If they walk and cycle instead of using the car, the air will be cleaner, and you find yourself bouncing around inside this circle. So these are not 10 discrete independent factors. They're 10 clues as to what we should be thinking about when we're thinking of how we design and manage streets. So now you know what it is. The next question is, how do you get healthy streets? Well, not by just calling them healthy streets. So this is a street in Hong Kong that is called Healthy Street. But now you've seen a little bit about what Healthy Streets is focused on. I think you can probably see that this is not a very healthy street. It takes more than a branding exercise to deliver genuinely healthy environments. You have to make really bold choices about making it easier to walk and cycle and spend time on a street. And that generally means reducing the ease at which people can drive through and park on the street. This is very much a cars first environment that we're looking at here. And as I mentioned earlier, you can't get healthy streets while still making it the easiest option for people to drive and park. You've got to shift the balance so it's becoming easier and more convenient for people to walk and cycle short journeys than it is for them to drive. So you can't just maintain your traffic capacity and make some nice little changes around the side that look pretty. You have to address the real root of the problem that we have, which is that traffic dominance is really impacting on our health. And to do that, you need to change the whole system. It's not just about street design. It's not just about activation. It's not about community advocacy. It's about all of these things and so much more. So in London, they have already been through this very lengthy process of whole system change, and it continues today. It takes time, and it requires us to engage lots of different professionals in lots of different fields and getting them to think differently about what streets are for and what we're trying to achieve. So here you can see all of the statutory strategies of the Mayor of London. All of them are framed in terms of healthy streets. How can we deliver healthy streets? Through our policing and our housing, through our environment policies, through our spatial plan, and making sure they all work together. And that's only possible because the Healthy Streets framework has been especially designed to be universal and easily understandable by lots of different people from different fields. When you look at these 10 Healthy Streets indicators, you don't see transport jargon. You don't see designer jargon. You don't see public health jargon. You see plain words that anyone can understand. And they're all framed not in terms of what is going to be on the street or the detail of how it's designed, but what is the outcome we want? How do we want this place to feel? And anyone can judge how a place feels because it's very personal. So it's possible for anyone to engage with this framework. And that is a really important part of getting that whole system change to happen. So I'm now going to take you through each of the indicators, but showing you an example of one of the systems that needs to change to get those healthy streets outcomes. And we'll start off with easy to cross. And the one that I want to start with is the one that people tend to focus on, possibly too much. New design standards. It's always the go-to. We will get a healthier environment by changing our design standards. Yes, certainly updating design standards is an important part of it. And one thing that has changed in London is that those side street entrances I showed you earlier, it's now pretty much standard practice that we aim to have these continuous straight across crossing points on our side streets so that people driving cars have to stop and wait before they turn, and people who are walking have priority to walk along the street. They don't have to stop for the cars. So these kinds of new design standards can make a big difference. They don't have to be big, expensive public realm projects. Small changes to how things are done every day is really important for delivering at scale, and that's an important part of it. It's not about one nice high street in the middle of a big grotty town. It's about making sure that every single street is meeting people's basic needs. Shade and shelter. This is so important, not just because there's so many people who need it so that they can actually go out onto the street, but so that it's pleasant for us when we do go out. And we all have changing climates, and we all need to be thinking about when people are walking and cycling in heavy rain as well as in hot sun. And I want us to focus on something that sounds so mundane, but is so important, which is our maintenance programs. And often our maintenance programs, the budget is cut, and then the budget is cut some more, and then the budget is cut some more. But if we don't have a good, strong maintenance program, we can't do things like retaining our mature trees. We can't do things like introducing new on-street greening programs. We can't do things that will actually make the street feel much more comfortable as our climate changes if we don't have a budget for how we're going to maintain all these plants. So maintenance is key, and giving it the priority that it deserves is so important. Places to stop and rest. Businesses. We've already heard that businesses can be really challenging to work with. It's important to have a framework that means you can bring them on board and that they can see the benefits to them of the street changing. So this is one example of where the businesses were involved in actually introducing the on-street seating. The businesses can see the benefit to them of making the street more convivial for people to stop and rest, and really working more with the private sector can help to deliver some of these outcomes. The next is not too noisy, and noise impacts on our health both directly and indirectly, and it's under-recognised how important noise is. And there's so many things we can do to reduce the noise levels on our streets. One aspect of it that I think doesn't get enough focus is thinking about deliveries and servicing, and how we can switch a lot of our deliveries and servicing in urban areas over to electric vehicles, and ideally over to electric bikes like this one. They are capable of carrying huge quantities, they can move fast, they're efficient, they deliver so many other benefits in terms of cleaner air and healthier people and more interesting streets, as well as making them less noisy. People choose to walk and cycle. There's a lot of aspects to this. The one that most people tend to focus on is thinking about cycle tracks and throwing down plenty of cycle tracks. And yes, you do need to have appropriate safe space for people to cycle, but if we genuinely want a lot of people to take up cycling, we need to think about all aspects of it. And one big part of people choosing to cycle is having convenient bike storage, which in urban spaces can be really challenging. So here's one example of a programme in London. This is an on-street bike storage. It takes up the space of a car parking space. 5 or 6 residents can all lock their bikes inside this, and then it's securely locked as well. So one thing that's great about this is that it shows that that street space can be used for something other than parking cars. Another is that lots of people have reasons to be out on the street and interacting with each other. And a third is that for the people who cycle, their bike is so convenient, they'd actually have to walk past it to go and take another mode of travel. So by default, it's easiest for them to cycle a lot more journeys than if their bike needed to be carried up and down stairs, for example. People feel safe. This is an indicator looking not only at road traffic injuries, but also about social safety as well. And often there's a big focus on the physical layout of the street, and we don't think so much about how people are using it. And it might sound very, very boring, but making sure that everyone has access to free cycle skills training makes a big difference. And often there's a focus on kids, but what if their parents don't feel safe and confident cycling with the kids on the street? That means they're not going to be cycling every day. And not enough focus is on the professionals. I think anyone who's involved in the design and management of streets should have done cycle training, and they should cycle as part of their job. It's a core part in terms of doing your job well, to know what it feels like to cycle it. So something you can ask yourselves is, how many of my colleagues know what it feels like to cycle on the streets that we're designing and managing? And it should be 100%, particularly amongst the senior managers. Things to see and do. I thought I should mention something about sustainable urban drainage. This was an opportunity when there was a new development. The footpaths needed to be relayed, so they took the opportunity to address localized flooding by installing some sustainable urban drainage. So it takes a fight every time to get one of these in, because it's new and different and complicated, but every time it's worth it because it's helping to transform the city into one that's better able to cope with the climate that we've got coming. People feel relaxed is an indicator that captures many aspects of what it feels like to be on streets, including whether we have a nice wide open space, we can walk in a group having a conversation, whether it's clean and in good condition, whether there's interesting stuff to play on, step free. There's so many things that contribute to how relaxed we feel when we're walking and cycling. And one way that we're helping to deliver that in London is by setting very high standards for all the new developments. So in our planning rules, if a new development comes forward, it has to be delivering streets that look more like this. So this is a new development. You can see the left-hand side has not even been built yet, but already the street has been designed to be a very relaxing environment with play facilities and places to sit, nice wide footpaths, trees, planting, rocks, all the things that people need so they've got a relaxing environment. Clean air. You will know the vital, important role that air quality has in our health. We're learning more about it all the time, but not all the healthy streets indicators are best served by individual measures on individual streets or working with one particular group. And this is one of them. For London, the way that clean air is most impactfully being addressed is through reducing polluting vehicles that are allowed into the city. So there's an ambitious programme called the Ultra Low Emission Zone, which has had really significant impacts on reducing some pollutants from vehicles on the streets of London. And that is something that is done over a region. It's not just done street by street. And our final indicator is everyone feels welcome. And this is a very difficult one to achieve, and it really requires us to engage with all the people in our community who we don't normally talk to. How do we engage the communities in change and get them to think about their streets differently and looking at their streets differently? If people have only ever seen their street as a place for moving and parking cars, they're going to struggle to understand what it is that you're proposing. So lots of temporary events and opportunities for people to try other things out really helps to bring people with you on the journey of delivering healthy streets. So the healthy streets approach means changing the whole system. It means changing design and legislation and monitoring and management and training and working with businesses and working with communities. There's so many different aspects to it, and if we don't work on all of them, we will really struggle to deliver at the pace and scale that we need to. So some good news is that we have some tools that help with this. And the first one I wanted to show you is this Healthy Streets Index. Now, this is a map of Greater London, the region of Greater London. It has a population of about 10 million people, and you can see it's black, but on top of that, we have laid every street in London, which is color-coded red, yellow, or green, depending on how healthy it is. So of course, as soon as this map appears, we all go straight in to find our own street and see whether our street is red or yellow or green. So there's my street there, and you can see, luckily, it's a green one. But in seriousness, this helps us to see, where do we need to be putting our energy? Where do we need to focus our resources and our effort? So we don't just pick off one street. We think, right, we've got to deliver at scale, and we're going to have to do it fast, and we're going to have to focus on these streets. The index is put together by taking city-wide data sets, land use, street network connectivity, population density, pavement widths, traffic levels, air quality and noise, all these things are layered on top of each other and weighted against the Healthy Streets indicators. And what this does is it helps us to think about streets not just as individual sections, but also about how connected they are to the places around them, which is also really important in terms of healthy streets. So this one here you can see is the example of London. We're currently working on the version for Barcelona, and we're also working on some other UK cities as well. But just to give you some examples so you can understand what this means in practice, here's one street in London. It looks pretty lovely, doesn't it? It gets a score of 84. You can see the pink dot shows you where it is. 84 out of 100, Healthy Streets Index score. Here's another street, also in the inner part of London. This one only scores 28 out of 100. So immediately it helps us to explain to decision makers, we're going to have to do something to address this difference. Why do some people get to live on a street that scores 84 and others get to live on a street that scores 28? What are the implications of that and how can we address it? So this index is really helpful for helping decision makers to grasp the scale of the challenge and make sure they don't focus too much on maybe the city centre or a few flagship projects, but thinking about the policies they need to deliver at scale. And then the Healthy Streets Design Check. Maybe you've heard of this. It tends to be the most famous of the Healthy Streets tools. There's already a tool produced by the UK Transport Ministry for England. There's also one for Australia. It's a simple spreadsheet tool. It assesses the design of a street to help designers to prioritise the Healthy Streets indicators. You can use it on existing streets and on proposed designs, and it doesn't take too long to do. Here's an example of a project I worked on during the pandemic. It was a temporary change to a street. You can see what the street looked like before in the smaller picture, and the bigger picture showed what it looked like as part of our temporary improvement. So we put in a traffic filter, a bench, planters, and a drop curb. Nothing massive, nothing very expensive, wasn't too difficult, but even these small changes delivered a huge improvement in the Healthy Streets Check score. The score went up by 10 percentage points from 29 to 39. And the way the results from the check are presented makes it really easy for us to explain the benefits of what we've done. So this tool is great because it helps designers to think about the whole street and the human experience, shifting their focus away from individual modes of transport and movement. It can be used in option appraisal and setting targets. You can use it to facilitate conversations between all the different stakeholders in a design, and it helps to build transparency and trust with the public because these results are so easy for everyone to understand and engage with. So there's a whole range of Healthy Streets tools that you can download for free from the Healthy Streets website. There's a qualitative street assessment, a household survey, a city index, and a design tool. And if you've got any more questions about it, please feel free to get in contact with me. Thanks.